Welcome to the Gaslight Effect Podcast. I'm Robin Stern, co-founder and associate director of the Yale Center for Emotional Intelligence and author of the best-selling book, The Gaslight Effect. I'm an educator and a psychoanalyst, but first and foremost, I'm a wife, a mother, a sister, aunt, and healer. And just like many of you, I was a victim of gaslighting. Please join me for each episode as I interview fascinating guests and explore the concept of gaslighting. You'll learn what it truly means to be gaslighted, how it feels, how to recognize it, and how to understand it, and ultimately, how to get out of it. Before we begin, I want you to know that talking about gaslighting can bring up challenging and painful emotions. Give yourself permission to feel them. Some of you may want to go more deeply with your emotions, while some of you may hold them more lightly. No matter what you're feeling, know that your emotions are a guide to your inner life. Your emotions are sacred and uniquely you. Respect and embrace them, for they have information to give you. If you want to listen to other episodes of the Gaslight Effect podcast, you can find them at robinstern.com or wherever you listen to podcasts. Thank you for being here with me. Welcome, everyone, to this episode of the Gaslight Effect podcast. I'm delighted to have Helen Riess, Dr. Helen Riess, with me today. Helen and I are members together of the Consortium on Research in Emotional Intelligence in Corporations and in Organizations, and it has the acronym of CREO. I met Helen there several years ago and have been fascinated by the fact that you, Helen, have devoted your entire career to not only studying empathy, but to giving it to us in a way where we can learn it and teach it and make the world a better place. So Helen, just as a short bio, welcome, Helen, first of all. Delighted. And Dr. Riess is the founder of Empathetics and currently serves as the chief medical officer there. She is a Harvard professor who will stand firm in her conviction, mine too, that empathy is not a soft skill and it can be taught and learned at any age, and that she has the way to do it. So I just invite you, Helen, now to tell your whole story from the beginning of how you, what turned you on to writing and researching empathy?
Well, I think it really started in my residency when I learned about the work of Heinz Kohut, who was one of the early psychoanalysts who really broke away from traditional psychoanalytic thinking, which was at the time based in, drive theory, that we're all driven by the pleasure principle and that we're driven by sex and just watching out for ourselves. Heinz Kohut had quite a different take on what it meant for people to live fuller lives and specifically to heal from any mental health challenges. And his writings really introduced the concept of empathy as psychological oxygen. And he said that without empathy, there could be no cure. And in my own clinical work, I implemented his principles, and it was really through understanding the perspectives of my patients and going with some of the sometimes distorted thinking or the perspectives they had that were not 100% aligned with how other people were thinking, but just by understanding where they were coming from, we got to a much deeper level of trust and engagement that led to really profound healing. So that's how it started.
So beautiful. I myself am a student of self-psychology. I don't know if I had shared that with you, but it's one of the reasons that I was so drawn to your work and to your focus on empathy. So how did you come up with a way to teach it?
So I was in practice for about 10 years before I really got into empathy research. I had a research group at Mass General, and we were all clinician researchers working on different you know, questions about what makes psychotherapy work better. And in the 2000s, all of us were noticing that our patients were spending a lot of time bitterly complaining about their healthcare experiences, that they felt like they were being treated like a number. They felt that, their clinicians were staring into computers and making them feel like an afterthought. And there was so much discouragement, people who really tried to follow recommendations and then the clinician would forget to ask them how they did, or like would put them down before even understanding what they were doing. um, it was a research assistant who said, I think these people want more empathy. Too bad you can't teach it. And so I had just received a medical education fellowship at Harvard Medical School where I could explore anything, like over the course of 2 years, delve into any topic. And when I heard that, I thought, we certainly know how to beat empathy out of people because these clinicians all started with the right motivation and the right skills, but it was deteriorating. And so that's where I really delved into the neuroscience of empathy to see how can we expand this human capacity.
Mhm. And so, what did you discover while exploring the neuroscience of empathy?
Well, the timing was just perfect because the brain imaging and the scientists really exploring what happens in the human brain when a person sees another person suffering. You know, how is it that we suddenly get a little twinge of pain when we see somebody in pain? And these neuroimaging studies revealed that when we simply observe somebody getting a shock or stepping on glass or some, really noxious kind of image, that our own pain centers get activated.
Even if it's not happening to us, you mean?
Exactly, just by
Wow.
watching. And so I call that shared mind intelligence because in that moment, there's an overlap between another person's experience and our own. And when we get that hit of discomfort or pain, two things generally happen. We learn what to avoid so that we don't step on glass or get our hands slammed in a car door. But also, the beauty of that empathic resonance is that it motivates us to help. And there are actual brain circuits that connect pain centers to motivation centers. And that is why people want to help when they see others suffering. And I do want to just point out, just because we're motivated doesn't mean we always do it, right? And so we're not constantly acting on these motivations. Sometimes we're pressed for time, we're distracted, we have other things to do. But even that feeling of like, I should have done more for that person, that comes from that motivated desire to help, which actually is responsible for the human species surviving.
Well, that's a big, that's a big statement. And you're so right, of course. So we'll get to the barriers as you started to talk about them now, but we'll get to them in a minute. But I wanted to go back to something you just said, which is the shared mind experience. And so is empathy really like stepping into someone else's shoes or stepping into somebody else's feelings? Or is it like a shared feel? Is it just a shared feeling or are you actually feeling their feeling? Or maybe that's the same thing. So can you clear that up for our listening audience?
Yes, so that's a great question. So, just to start, empathy has feeling or emotional parts and it has cognitive parts. So, right now we're talking about what's called emotional or affective empathy. And so, when our brain centers, when our pain centers are activated by seeing someone in pain, we are feeling discomfort. Now, we don't feel the whole pain. We feel a touch of the pain because these are the mirror neurons people talk about. We we have neurons that mirror the suffering of other people, but it's all in an attenuated, lesser degree. And of course, that's really important, Robin, because if we felt the full hit of the pain, we would be focused on ourselves, right? So, like, I always use the example of getting your hand slammed in a car door. If we got the full impact of that, we would be running for help for ourselves. But we get this cringy feeling if we see that happen. And it's just a minor experience of that. And that's what motivates us to help. It's like that must have really hurt. You don't just get in your car and drive away. You usually would go and say, "Are you okay?" and try to help the person.
So what happens then when you're sitting with somebody and it's not a like a sudden or a just momentary uh, emotion that you're kind of catching in your empathic resonance, right? Um, it, but rather like a feeling if you're sitting with somebody who's telling you how sad they are or who's telling you that they're depressed or they're who's telling you that they feel unseen and it's not like getting your hand slammed in the car door. So how do the mirror neurons work then? Is it the
Mhm.
same process?
So you're talking about what's the difference between physical pain and emotional pain?
Yeah, well, neurologically, actually, I'm
Yes.
asking. Yeah, uh-huh.
So that's another great question. The human face is able to perceive sadness, anger, fear, surprise, disgust, contempt, that whole range of human emotions. And our facial expressions that we pick up from other people, they also land on our emotional centers. And so it's in our empathy training, that's actually a key component is that we have emotion detection software and facial expression software where people learn how to distinguish between these different emotions so that they have empathic accuracy.
Wow. That's pretty impressive of the technology as well as of the process. That so you can pick up so somebody's you're training on a computer and you're served up a different face with a different emotion and you need to identify that or react to it. How does that work?
You identify a face and then you get feedback as to whether you were right or not. And
Wow.
you get descriptions of what made that face a disgusted face rather than an angry face.
Yeah. And so the goal is to be able, you tell me what's the goal of training like that? You get to know what somebody's feeling and you can feel it too, so that what's the so that?
So it's not only that you can feel it too, it's that you can respond with accuracy. So many people in healthcare, not in the mental health field, but they may mistake anger for disgust because part of the face for anger and disgust looks about the same, but not the whole face. So if you're just like looking quickly, and so the whole point of knowing the difference is that your response to that patient, if they're angry, is going to be quite different than if they make a look of disgust, right? Disgust often comes from handing someone a prescription for a medicine that made them feel sick. So they'll take the prescription and go, make a face. And if you miss it, you might think they're happy and they're going to go off and take it. But if you're perceiving accurately, you'll say, looks like you're not 100% on board with that. Can you tell me more? Right. And if someone's angry, you're not going to treat them as if they were disgusted. You're going to say, I'm sensing some, you know, a really important feeling right now from you. Can you tell me more about it? So the point of the facial discrimination is to ask the right question.
That's really interesting. And it brings to mind a question that I wanted to ask you about gaslighting, because this is, after all, the Gaslight Effect podcast.
Yes.
And so I'm wondering now um, whether you would imagine or think that people who are engaged in gaslighting other people are pretty good at reading their facial expressions, so they know how to get in there and turn their world upside down.
Yes. I think what you're really referring to here is the dark side of empathy. Yeah, because empathy includes perspective taking. That is the cognitive part that I mentioned earlier. That's our ability to imagine somebody else's circumstances. It's not just getting a hit of their emotion or their pain. It's like, what would this be like for a person living in this place, in these circumstances? And gaslighting is a form of psychological manipulation where you're pretty good at imagining, you know, what that person's going to think after you said something. And then using that perception, that knowledge to try to deny what they just heard you say or what they just experienced. And it's a pretty sophisticated uh ability. Um, and it can be used in such destructive ways.
Yeah. Do you see that in the hospital? Do you see that between doctors and nurses? I mean, I suppose so, because there are human relationships, and not all human relationships have uh, are healthy. You know, not everyone is somebody who's a straight shooter, and some people do manipulate. And I wonder, because there's a power dynamic often between a supervisor and someone who reports to that supervisor, or between even a doctor and a nurse. And I'm wondering what your thoughts are about that.
Well, I don't think healthcare is in any way unique where that would never happen because, as you just said, humans are humans. And in a power dynamic where someone is trying to save face or has made a mistake and doesn't want to admit it, or has written an order that isn't quite right, um, you would hope that people would be able to say, I'm sorry, I misstated that, or, that was an error. But many people in power positions find it very difficult to admit they've done something wrong and they'll try to rearrange reality.
Right. And so maybe to say, they might want to say, and like people do outside the medical profession, I never said that, or you misheard me.
Yep, I think that that is it's a very, unfortunately, a common technique when people cannot admit that they've done something wrong or that they want to lead people to believe something that just is not so.
I think that something I've noticed about people who are busy doing gaslighting is probably pretty common among uh, certain positions, certain roles in leadership or authority in the medical profession, in the same way that it would be in other places where somebody's in charge, and that is certainty. So when somebody who is in charge says, I'm sorry, I never said that, or you misremembered that, or that's not correct. We would never do that, or I would never do that. I think maybe initially you say, no, 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 you did, but all too often, especially for women, I've noticed and been witness to in my own practice and surveys, et cetera, where we're all too ready to accuse ourselves if we can't say for sure, no, you did that. If over time, when the person in power insists with certainty.
I think you're really hitting on something important because gaslighting, I think by definition, causes confusion, loss of confidence, anxiety, and even like a depression. And we don't all remember exactly what was said, but we try to believe that when people say something, they're going to stand by it. So if a person in power says, "Oh, I never said that," or "No, no, you misheard," um, it can cause some self-doubt. Like, "Oh, am I crazy?" And then people often like call somebody to say, "Did you hear him say that?" Or "Did you hear her say that?" So they want corroborating evidence, even though they actually know that what they heard was what they heard.
Right.
Um,
I think that's so important because at the end of the day, when people do come to the awareness that what's been going on is gaslighting, they say, you know what? I knew that. Somehow deep inside, they knew that. And yet they couldn't bring the full force of who they are behind that statement exactly because of what you just said. That here's this person who's saying something opposite of what they knew, and they knew that they knew that, and that person's in power, and that person is certain. And now maybe I'm not so completely sure.
this is particularly um, important for people who've grown up bullied to some degree or made to feel that their emotions were, overreacting, you're too much, whatever.
Drama
And that
queen, yes.
exactly. So people whose emotions are consistently denied or underreacted to in early childhood, and then when they get into adulthood, they've learned to question their emotions a lot. And I think the real danger with people who do gaslighting is that they're pretty good at spotting people who will start to equivocate a little bit or like, oh, sorry, I thought you said. And then they sort of know, like, oh, that person won't be that confident.
Exactly. Or they just happen into it because they don't want to acknowledge the truth about where they were the night before or then of them making a mistake, as you said. And then they realize, wow, that worked. And she's a softie. I can do it again. And maybe it's not operating on a conscious level, but it is operating. Yeah. So thank you for that little visit to gaslighting and empathy. But I'd love to, and I'd love to now get back to the barriers to empathy. And I actually even wonder as I'm saying that, what what's the gaslighter's barrier to empathy, to positive empathy?
Well, that's a big question because not all gaslighters are the same. Um,
Fair, yes, of course.
um, I think people who use gaslighting as a regular mechanism are deeply insecure people who find it very hard to say, I did say that, but I shouldn't have. I misspoke. Like they're on shaky scaffolding to begin with, and so to admit a mistake or to admit anything that, you know, challenges how they want to come across, um, they'd rather just flip reality.
Yeah, and I think that back to our um, both being self-psychologists or disposed to think in that way. I think that when somebody who is engaged in gaslighting behavior starts to feel that kind of fragmentation, they like jump into gaslighting or blaming to right themselves so they can feel more stable in that moment of discomfort.
Yes. So you're right. There's a ego disintegration happening when someone stands up because it's a very fragile psychic structure to begin with. And I guess the paradox really is that the more skilled you are at gaslighting, the more powerful you can appear because you're just up there denying reality and telling people what they heard is not so. But the more fragmented you become as soon as you're challenged with a discrepancy.
Exactly. Exactly. And that is um, quite interesting to see that.
I mean, it's one of the great paradoxes that the weaker you are intrapsychically, sometimes the more powerful you appear.
Right. Exactly. Putting on that suit that, it's like standing in your parents' clothes. You don't belong there. You can't fill it, but it's
It's your
kind of feels
protection.
good. It's your protection. Exactly right. Well said. Yeah. So back to the barriers of empathy in non-gaslighting relationships, but just in general, why is it so sometimes hard for people to uh, tune in, to really connect, and to even give their mirror neurons time to work?
Well, I'm going to go back a little bit to like the nature nurture um,
Thank you.
conversation because people's empathy, you are most likely to develop empathy enhancement and skills if you see them modeled in your family when you're a child. Like if parents show that you should really give consideration to other people, that when people are sick or injured, that you feel for them and you try to do something nice, or that you teach your children to take other people's perspective. So if somebody's mean to your child and they hate them, like that's typically the that you ask what might be going on that they treated you that way today. That just isn't like them. So that you start to train a mind to have theory of mind. Why would that person act this way? So um, developing these skills early on is the best. And a lot of healthcare people I've met will say, "Why are you teaching empathy to doctors? Don't you learn that in kindergarten?"
You wish, right?
But it's all to show that even some of the skills and capacities that we learn in childhood can get drummed out of us. Um,
Mhm. How does that
with,
happen?
with adverse circumstances. So I'll just also say that when you don't have this exposure in childhood, it is much harder to teach empathy because that hasn't been part of your makeup growing up, right? But even if it has, when you put people in adverse situations, and I would include probably medical school and nursing school as pretty adverse because the amount of new knowledge they have to acquire and the consequences of not learning that knowledge correctly, that you can actually really cause harm. Um, it is a big burden. And interestingly, the biggest drop in empathy in medical students is in the third year, which is when they start interacting with patients.
That I would never have thought that. That's so interesting. Is that because they have to now make room for some skills that they haven't really been thinking about?
I think it's multifactorial, but they haven't been thinking of, they've been cramming their brains with how to treat congestive heart failure, how to like which antibiotic to use for which pneumonia. So the head is full of like trying not to make a mistake diagnostically and therapeutically. And they almost forget that there are people behind these conditions. But also, I think one of the biggest surprises, Robin, is that medical students have very little preparation for how emotionally high stakes the relationship is when someone is sick or their relative is dying or they're in severe pain or they have a severe addiction. Like people are not always what you see on, Marcus Welby, like coming in and having a problem, having the doctor fix it, and everybody's happy. Many times people are at their worst. And I think that's without proper training, that's what can cause defensiveness and, oh, I don't like that, how that person talked to me, without having the empathy that they're at their worst, they're having their worst day today. So it's pretty challenging.
Wow. I was just thinking about the series The Pit.
Yes.
And I what did you think about that? And for me, it was just this like, yes, medicine is an emotional profession. Um, do you think it was good for teaching empathy?
Well, I actually thought it was phenomenal because it really showed how many ethical dilemmas, moral dilemmas, physical challenges, emotional challenges these emergency room doctors are facing. And it's pretty overwhelming, like how many, people dying, people's children dying, somebody dying of a drug overdose that didn't even know they were taking a drug, so
Yeah.
I think that first of all, it helps people understand why the waiting rooms in ERs are so backed up.
Yes, that's very true.
Because I think people have no idea what is going on behind the scenes. And I felt that Noah Wiley's character was superb at preserving empathy. When some of the younger residents and doctors were fed up or rolling their eyes, he had this brilliant way of bringing it back to what's happening to these people.
Yes, I agree completely.
Oh, good.
Yes, I was completely fascinated with it. And I felt for him when he just came apart in the episode. And yeah, and he became, I think it was, many people felt for him in that moment, not only because it was a really tough moment for him, but also because he was such a feeling person and he was so there for everyone else. So yes.
It certainly made you realize the fragility of and the limits of human compassion, that you can only take so much if you're not nurturing yourself. And the blonde nurse who keeps saying, take a day off, you need a vacation, you need, like, her advice just goes in one ear out the other.
Right. And she was the voice of that. You need self-care. So I'm glad you brought up the word that you said the word compassion, because I was going to ask you, for our listening audience, what's the difference between empathy and compassion?
This has become my favorite question because everyone asks me.
I
And
figured they did.
okay, empathy is our capacity to perceive suffering, right? It's taking in, it's the input. And then, as I said earlier, it connects to motivation centers that make us want to help, but we don't always help. But when we do, the output, the visible part of caring, that is compassion.
Beautifully said. I love it. I'm going to be quoting you that when you said it so succinctly. I love it.
I think the reason there's so much confusion is that these things happen so fast that people don't realize I've just had an input and now I'm having an output. Like sometimes compassion is just a really kind look at someone. And it's an automatic millisecond thing where I'd see some, concern on your face and I would shoot back a concern on my face. And that's why people feel like it's all one thing.
Yeah. No, it's interesting. I was putting together a presentation, an article this week on co-regulation. And this is like empathy and compassion, or in that territory. Do you talk about co-regulation?
Well, our empathy training, the co-regulation is embedded deeply because one thing we haven't talked about yet is, well, we just touched on it with Noah Wiley. You only have so much capacity to take on other people's suffering before you can get so burdened yourself that you get burned out, that you feel like you can't do this job anymore and you quit.
Yeah. And what do you call that in your world?
Well, for many years, we've called it self-regulation because what we're trying to teach is how do you manage your own emotions so that you don't just react or that you don't absorb all of this coming from another person and walk around like, 200-pound weights are on your back. But I think you're more accurate to use the word co-regulation because by slowing down, pausing, and not reacting too quickly, we are also sending a message of greater calm to the other person. It's all a loop. Like we're all constantly feeding off each other's
Exactly,
energy.
exactly. So when you do your training, is there a part of it that is interpersonal as well as training on using technology?
Oh yeah. We have a blended approach, and that means there's online education, and we strongly recommend in person or even virtual workshops where people can bring their challenges and we can work with individual, and they're usually not that individual, usually one person's empathy challenge. Most people are like, oh yeah, I've had that. That's happened to me. I said the wrong thing. I didn't
Uh-huh.
know how to like get out of that situation.
Hmm. What's one of the biggest barriers that you've heard to being there for other people? Is it that like I didn't come up with it at the moment, or I just was too something that to be empathic?
I find, and this is in the healthcare world, um, it's very hard for healthcare workers to feel like they weren't helpful or that they've disappointed expectations. And so if a patient comes and says, that ointment didn't work, or like, that medicine, like, I'm still having the same pain, that there is I don't want to overgeneralize, but I've shadowed enough, clinicians to see there's a tendency to become defensive instead of to just open curiosity. Well, if you had taken it the way I said, your rash would be gone by now. Or, well, did you take it 3 times a day or did you just take it once a day? So it's always kind of I mean, not always, it's often a way to blame the person for the problem rather than saying, tell me how how did you use the staff? And like in a friendly way, just hear from the person what they did before assuming they did it wrong and defending yourself. So I think self-defense is a huge impediment, but I also empathically know it's coming from, I really wanted to be helpful and I'm really upset that it didn't help.
Right. Exactly. So I have one more question before we begin to wrap up. And um, you said that we're living in a time of tribal empathy.
Oh,
And
it is in the book. Yes.
yeah, and can you say a little bit more about that? Because I so agree with you, and I'd love for our listeners to hear about that.
Well, it's a known fact that it's easiest to have empathy for people who are the most like us because we can project our experience easily. If we look like each other, we speak the same language, we're from the same part of the world. It's always a little more challenging to have empathy for people who are very different. I think today the the grouping people are finding themselves in or putting themselves in, it's almost like concrete casing where we're forgetting what connects us and that there's always pores between, where you can exchange or find common ground. And I worry that in today's climate, people are just doubling down on who's like me and who thinks like me. And the broad generalizations where somebody might use one phrase and you immediately put that person into like this group and then you want nothing to do with them. Forgetting that it's often a few people's ways and behaviors that we really object to, and not necessarily huge swaths of people.
Thank you for that.
Mhm.
I just feel like I could talk to you for a very long time about this.
I know we have self-psychology in common.
Well, and it is, you have a beautiful presence and you're so warm and safe to talk to. And so I think that it makes conversation flow really easily. And I appreciate that. And you're,
Likewise.
thank you. And you're so smart about empathy, which of course, the world needs more of than ever. And I just have a lot of respect for your years of study and research and focus, and you've given us so much. And in this short time together, like people are going to walk away, I believe, with several, wow, I didn't realize that, or wow, that's really true. And so I thank you for this time together, and I hope you'll come back at another time. And I certainly look forward to seeing you the consortium. But tell me first, besides your new book coming out, your paperback edition of The Empathy Effect, coming out on November 4th, which we're all looking forward to, what else are you looking forward to?
Well, I found out that our daughter is going to have a baby um,
Ah,
in the early part of next year. And
oh,
just the thought of a new little human being coming into the world that, you know, I I don't know, it's just such an exciting thought to, have the love that you have for your own children just expand to like the next tier. So I'm very excited. And I think at this stage of life, you just come even to the thought of parenting with so much more experience and
of course.
so many really valuable perspectives. So I look with excitement at how to interact with this new little child to, make the relationship as rich as possible.
Well, and how lucky will he or she be to get an early education in empathy from the expert?
Well,
Maybe you'll be working on a children's book at that
yeah,
point.
maybe. That's a
That's
good
pretty,
idea.
it's pretty exciting. So thank you so much, Dr. Helen Riess. And I appreciate you. Where can people find you?
Well, I'm on LinkedIn, and my last name is Riess because often that name gets misspelled a lot and people don't
Uh,
find me. So that's a very easy place to find me. And info at Empathetics is how you can connect with Empathetics or our website, empathetics.com. But I really appreciate talking to another psychiatrist and psychoanalyst who had such great questions. I really enjoyed our talk.
oh, me too. Me too. Thank you very much. And for all of you listening, I hope this was a special treat as it was for me, and I'll see you next time. Thanks for joining me for today's episode. I hope you found it helpful and meaningful. If you want to listen to other episodes of the Gaslight Effect podcast, you can find them at robinstern.com or wherever you listen to podcasts. And please leave a rating and a review. I also invite you to follow me on Facebook, LinkedIn, Instagram, and Twitter. I'm so grateful to have many people supporting me, and especially grateful for all of you, my listeners.